We have with us tonight a great panel. They're going to introduce themselves as we move through the conversation, and they represent a lot of diverse backgrounds. This is really important. We have varied and diverse expertise on our panel tonight, and this is really the collective wisdom and knowledge that we all want to engage in to transform our systems and build systems that work for young people, their caregivers, their loved ones, and their communities. I'm going to pass it over to Dr. Yuri Quintana. He's going to start us off tonight with a little bit of a summary of the survey that was done and what's been heard to date. And Yuri, while I pass it over to you to do that, I'm going to try to work on my lighting a little bit. So over to you.
Great. Thank you very much, Shauna, and to the panelists, and especially to all the participants who have come here today, and for you sharing your evening with us to provide us your input. Prior to this meeting, we did a survey, and so we're going to be sharing that information with you. I work at a medical center and called Beth Israel Deaconess Medical Center, and also at Harvard Medical School. And I also work at Homewood Research Institute as a senior scientist and at the University of Victoria. And with colleagues across Canada and the United States, I've been very interested in trying to understand how we can improve digital health for mental health. And the best way to do this is to work collaboratively across disciplines and to listen to the end users. And so this is the context of what why we're doing this. HRI has been interested in this field for several years and has produced some landscape reports that have described some of the trends that are happening and what are some of the ways to evaluate it. And as we look forward, you can get all of those reports for free on the Homewood Research Institute website. As we look forward, we're thinking about how to design better apps. How do we help others also evaluate them? And so your input is very valuable. We sent that survey, and I'm going to share with you some of those results with you. So just to provide some context and food for thought for this evening, this survey was responded by over 50 people, and it's still open, so if you'd like to go there. And so we have 3 themes today, and these are some of the comments that came in. One, we asked what works well, and you'll see that in some of these areas, people are finding apps, they are finding useful content and features. They said that they liked how to use those apps to be able to track their progress. They want to see apps that are versatile, and we can get into discussion today as what does that mean for you for something to be versatile. And they like that some of these have different strategies, such as cognitive behavioral components that they found useful to them. So we want to hear from you. What are things that have resonated with you that you would like to see other apps to also include and is important for you? We also asked what's missing. And so there was a range of different things. This is just a short summary of some of the things that came in. One of them is that they want this app to connect to the healthcare system and to real people. And so one of the questions that we're going to ask you is, what does it mean for that app to connect to the healthcare system? They also wanted to see how these apps could be tailored to their different circumstances and how they could be used for sharing data. Privacy was also important. And they also mentioned that while there's many apps for some conditions, there are other conditions and such as substance use where there's fewer apps. So we'd like to hear from you. What are the things that are missing so that we can help encourage other people and ourselves as well to focus on those missing features, content, and functionalities. And finally, we asked about a third theme about barriers. And there's, again, a range of different barriers, things such as cost. Some of these apps, for example, give you free content, but then additional features and content you have to pay for. And depending on the app and the price, that's a barrier for some people. We also had people were talking about concerns about privacy and knowing what's being tracked and what's being shared. And so we'd like to hear from you of these different things that are barriers, what are the ones that you think are the most important that we should all be focusing on? So you'll see, I think there's lots of good input that we've gotten, and we'd like to sort of continue that discussion. And we're delighted we have panelists who are going to share what they're hearing from their organizations. But we really encourage you to provide us your thoughts and comments through the chat area, and the whole team is here to help facilitate you providing that input. So let me pass it over now to Shauna, who will manage the discussion with everyone. Thank you so much, Shauna. Over to you.
Thanks, Yuri. And I think I'm hearing a lot of sort of key themes that you're speaking about as you go through what you've heard so far in the survey, and kind of talking about those three main themes. And when we're talking about what's working well, and I'm going to pass it over in a moment to Dr. Lena Quilty and ask her to introduce herself and give us sort of an overview on this. Thanks for turning on your camera, Lena. I think I heard, Lena, a lot from Yuri about this concept of nimbleness or adaptability, and sort of being flexible to meet those needs. So I'm going to ask Lena to introduce herself. I know you've put some thought to this kind of theme about what's working well, so I might ask you to lead us with that. And if folks can weigh in on the chat and maybe respond to what you're hearing from Lena, we'll pull from that and kind of embed it into the conversation. So Lena, over to you.
Wonderful. Thank you so much, Shauna, and thank you, Yuri. And welcome everyone. Thank you so much for giving of your time, being with us here this evening, and sharing your thoughts both via the chat and in the survey beforehand. My name is Lena Quilty. I'm a clinical psychologist by training. I'm currently a senior scientist at the Center for Addiction and Mental Health, in otherwise known as CAMH, in Toronto, Ontario. I'm also an associate professor of psychiatry at the University of Toronto, and I'm a newer member of the HRI family. I joined relatively recently as a collaborating clinical scientist, so it's been wonderful to join the team. And this has just been such a wonderful learning experience for us all already. So as a bit of a background about my area, I do a lot of work, or for the last decade or more, research looking at in-person psychotherapy for different kinds of mental health and substance use health kinds of concerns. And I'm only really entering the digital tool realm in the last 5 or 6 years. And what I was seeing, though, in the responses to our survey was aligning with some of the initial work that we did then and that we did at the beginning of the pandemic. And that was that despite all the advancements that we're seeing, that the three primary reasons that folks are using digital tools right now, or the three main use cases, are education, assessment, and tracking, like tracking your health over time. And it was amazing to me to see that, you know, in these different assessments that I've done in 2017, in 2020, and again, more recently with all of you. And so what I was hearing thus far is just really how important it is to, as Shauna noted, to have that versatility as well. And that was coming through in a number of the rating scales, but also the text-based questions. Many folks gave us really detailed responses, and thank you for that. They were so rich. And they talked a lot about how important it is that our digital tools don't just do one thing. You know, that it's important to do your job well, but to only do one thing and really have that focused on have digital tools that are focused on a single problem or on a single space in the mental health or substance use health spectrum really limits the utility of those tools for us. And so having tools that are a little bit more focused on the person rather than the problem really increases how useful it is, not only across different groups, but also over the course of your wellness and journey. You know, it helps you when you're preparing or looking to make changes in your health and then to maintain changes in your health. And it also means that you're not necessarily needing a different kind of digital tool for every little component of your health that you are looking to address and to be mindful about. And it also really got me thinking about, well, that's fantastic. I really love that idea, the idea of having more holistic, person-centered digital tools. Have that value be at the center of what we do, so that these tools can be relevant to a wider range of folks over time, and be really mindful of how their needs may change over time. But it did make me curious about how we can be sure to balance all of these different things at the same time. We want to give or to develop, that is, tools that have that user friendliness, but that also have choice. So how do we give folks choice and control, and also meet their specific needs and preferences, essentially balancing something that's streamlined but also nuanced, simple but also tailored. So I was curious as to any thoughts that our audience might have about lessons learned or advice to folks like me who are doing this kind of work, about how to find that balance between having developing and implementing tools that are focused on the person rather than the problem, but still can balance having that versatility and tailorability, while at the same time not being too cumbersome to use, still having that ease of use that we really need to. So those were some of my initial thoughts while I was going through these survey results, and I'm really looking forward to our conversation tonight to learn more.
No small ask, I don't think, to have that balance achieved. And I think we're actually getting a lot of comments in the chat weighing in on this concept of what's working and responding to some of what you're sharing. So Travis, I'm going to ask my colleague Travis to let me know what we're seeing in the chat and if there's anything that our panelists might want to respond to.
Yeah, absolutely. There's some great themes coming through around engagement and connecting, like having apps that connect directly with peer groups, so you have access to people with lived and living expertise that come from that peer support type of framework, and also digital tools that can connect with care providers to bring them into the engagement with the app as well.
That's great, Travis. Thanks. And maybe I'll Lena, anything you want to sort of respond to on that front before we open it up to our other panelists to weigh in?
I've got tons of thoughts, but I'll actually hold off and I'll wait on my other colleagues and friends here to hear their thoughts and chime in as we go.
Sure. Yuri, I know you had some thoughts too around that connecting piece and being connected. So maybe I'll ask you to weigh in a little bit on that piece.
Yeah, so I think that's a really great feature, but it's difficult sometimes to think about how to do it effectively and safely. So one of the comments that came in was talking about a safe platform for youth. And so the younger the youth are, the more careful you have to make sure that it's a very safe environment and they're connecting to people. So how to do that is something we need input from people of how to do that, and what role does the family play to make sure that the kids are safe and the platform has been vetted and safe. So there's some real challenges of how to do that safely. In the area of connecting with other people, the peer support is peer support has been used, even before digital. And so how do we blend what we've learned from pre-digital for peer support networks with the idea of apps? And again, that sort of ties in a bit with what Lena said in terms of providing freedom for people to navigate the app and connection, but at the same time, allowing some level of structure or functionality that is based on known methods that help. And so there are some interesting apps being developed, and I know that some of the panelists here are working with peer support and apps, but be really great to hear from the audience as if you've tried one of these apps that have peer support, or if you'd like to have that feature, how would you like to be able to explore that? And the third level of connectivity is connecting to the healthcare system. And so many apps, most apps, aren't very well connected or connected at all to the healthcare system. So if you want to use an app and then you'd like to sign up for a session, you usually have to go to a different medium. You have to phone or go to another website, and the apps aren't connected. If you do want to share information with your healthcare provider, or if the provider wants to share with you and be able to import it into the app, that connectivity and that communication doesn't exist very well today for the vast majority of apps. And so how would people want to see that connectivity? And of those three types of connectivity, which one should we focus on more immediately? Because as somebody else mentioned, a lot of these tools to do them well are expensive. So it's also a matter of thinking about priorities. So those are some of my thoughts about connectivity. More questions than answers.
Thanks, Yuri. And I think that, we're leaning into curiosity, we're leaning into learning today, and often that means we're leaning into questions. And I'm actually thinking, I'm going to pull a little bit from some of what's in the chat and some of what you've shared around the importance of peer support. And also how dynamic and different peer support can look from one context to another. We have conversations in the chat about peer support in general, in terms of using digital apps, peer support for providers, peer support for youth. We also have gaming as one of the themes that's coming up in the chat as well. We have conversations about child welfare and youth having a safe platform to have shared experience. And often that peer support philosophy is around shared experience. And one of the things that I heard both of you speak to kind of throughout what you were sharing is this relevance to people. That this needs to be about real people, not about the problems, about people, and it needs to work for people in their context. And so I'm going to actually ask one of our other panelists, Gord Garner. I'm going to ask Gord to introduce himself. And Gord, I know you've given a little bit of thought to kind of what we're moving into now, what's missing, but also that concept around lived expertise and real people needing this to work for them. So I'm going to ask you, Gord, to maybe share some of your thoughts.
Sure, and of course I've been listening like everybody else, and so the chat box is busy and so is my head. So my name's Gord Garner, and I first reached out for help a very long time ago, and it took me a long time to reach out for help, and I got a busy line, and then I got an answering service, and then I got an appointment for 3 weeks later. In the following 38 years, I witnessed literally hundreds and thousands of people try to reach out to have no success. And I didn't even know what they're reaching out for, and most of them didn't either. And so when we speak about connectivity, it turns out they were trying to get in touch with their hope. They're trying to get in touch with themselves, and they're trying to find some way to have that experience that was safe. And then I started helping people, and somebody said to me, "Don't worry about giving out your phone number. Nobody's calling anyways. Can't you remember how you didn't call anybody to talk about it?" And I realized that contact with another person was a barrier to seeking contact with themselves. And so the first time I saw an app, I was invited to a classroom, and I won't bother mentioning the app because it doesn't really matter. I cried when I saw that someone could get in touch with themselves, right? Without the barrier of a person, without the barrier of leaving where they were. And yes, not everybody's going to have a phone, and not everybody's going to have the app, but everybody that had access wouldn't have to get past anybody, past their fears, past their depression, past their lack of bus fare, past the concept that there's no help for me. I could press a button and be engaged in my own hope. In the end, that's who hope is going to carry us. That's whose belief is going to get us to the next place, is that if my hope is not unfounded, and if I can connect with my hope and I can connect to my experiences. Some folks, I know I don't want to be too controversial, some folks like to think that the connection is the opposite to some of these issues, but it's not to others. We're surrounded by people we know. Often we're surrounded by colleagues and workmates and friends and people we played games with. It's ourselves we're not connected to. It's the connection that's missing, is to be able to survive being me, to be with me in my experience. And so I see when we're talking about what's missing here is in-person care, collaboration with providers, wellness, self-care tracking. Hey, people want to take care of themselves. So and that's in there is buried the belief that I can't. Right? So this is what apps do. They engage people in the belief I can take care of myself, and there's ways I can have a better life, and I can do that. And now that I'm starting to do that, geez, it'd be nice for somebody to talk about, to tell them how I'm doing, and to see if there's anything else I can learn I didn't know before. So those are things that I really look at. I forgot to mention I'm a board member at HRI, but I don't have that hat on tonight, obviously. I'm here as someone who is deeply interested in two things: recognizing the offering of hope and self-connection that apps provide, recognizing the vulnerability that we are in when we take that step, and the need to protect us from predatory practices that would use our need for others' benefits. And so I see a lot of purpose around what we're doing. I hear a lot of knowledge from Lena and Yuri around that need, and from yourself. And I'm very interested, though. That's me rambling on a bit. Sorry, everybody, I do that. But I'm very interested in folks identify what they saw was missing. So I want to ask the audience a question. If what was missing was there, what would be different for you? Why does that matter? So, there's a list here. Why does it matter to option connect to a real person? What's that going to change for you? If it was going to integrate with in-person care and the person that was at the office, I can't see tonight, but I'm online. What's that going to do for you? Self-tracking of my care and my emotional state, what's that going to do for you? And focusing on harm reduction, not necessarily any great expectations. Why is that going to serve you? And so I don't know, I see comments coming in. Time for me to be quiet. Shauna, I promise you tell me.
I think that, I think it's a strong question, and I think it's a really resonant question. And you're getting some reflection that, well said, Gord. So I think it would be great to have that sense. This is about listening and collectively coming together to understand more. And so what would it change for folks? And I think what I heard you speak a lot about, Gord, is autonomy of person. That people inherently have the knowledge and have the power, and that what we require in a system, including a digital health system, is to be a facilitator of that individual autonomy and power. And so I'm going to ask Travis. Travis, I know we're seeing a lot about peer support here. So for our panelists, that's a really resonant theme, I think, with our audience in lots of different ways. I think we're seeing a little bit about that coaching piece around having that, but a little bit of mixed perspective here around if that can be beneficial or maybe a little bit of a hindrance, depending on how much the person can connect with the person that they're talking to or is providing them service. So some of those topics I've seen. Travis, anything else kind of coming through, connecting to what Gord's been sharing?
Yeah, absolutely. Some people have said they've used apps with personal coaches, and that they didn't feel like that it got them, the app and the coaching got them and connected with it. And I think that's really important. And so there is a question in the Q&A about that is it safe, and maybe is it ethical to actually have an app that doesn't connect you, right? That doesn't connect you with an expert or somebody to talk to, because then you're just sort of giving them information and resources without anything to really do with it. And so I'd love the thoughts about the ethics of connecting people with experts, with coaches, with peer support, and that sort of thing.
Thanks, Travis. That's really great. Any interest from our panelists in sort of responding to some of those thoughts?
Can I do that?
Go ahead, Gord.
I'm always cautious with the word hope, because it's an imaginary condition for folks who haven't experienced its outcome yet. And so when we're talking about connecting with our own hopes, we're also creating a great sense of vulnerability because my hopes in the past didn't work out for me. And so that needs to be very safe. And I once said to somebody, if you want to know how to sell hope, you'll have to talk to the Ontario Gaming Commission, And so there's this piece that by having so many of these platforms and so many people engaged in this and having these conversations, we're establishing a practice of hope. And so that people can see and witness that, maybe not this one for me, but there is one for me. I just need to keep looking and find the space, because this is helping people. And again, it's helping people because they believe there's help. And people who believe there's help find it much more often than people who don't believe there's help.
That's great, Gord. Thank you. Any other, probably one final comment, maybe? Lena, I think I saw you. Yeah, go ahead.
It's such a great comment. So thank you for all the thoughtful comments. I think the comments about connecting folks to peer support and the promise of that is something I could not agree with more. Peer support is decades-long component of our healthcare system and critical for both mental health and substance use healthcare. And to me, the ethics of connecting folks to digital supports that may or may not have an in-person component to it boils down to, in many ways, to communication and consent, and being very clear about what these tools can and can't do, and ensuring that they are empowering folks to use them for those purposes, but also communicating where to turn if their needs change and their needs become more than what that tool is able to address. Because it is absolutely key to ensure folks have knowledge about where to turn if crises do arise, but in the meantime to be clear about whether or not this app is appropriate or useful to you in this or that or other circumstance, depending on how you're feeling. So to me, it's really about communication and consent.
That's great. I think we're seeing such great conversation in the chat, and I know, just so folks know, we're capturing this. Becky, can I confirm that we're capturing what's being said in the chat?
Yes, we are.
Okay, wonderful. So we will have all of that great thought that's there as well, because I don't think we'll get a chance to move through all of it. But I did want to touch on one piece here, and I think it's really this concept of integration that I'm hearing through the chat and through what the panelists are sharing, that I'm going to be bold and say that, like, apps are not a health system unto themselves. They are part of a health system. And so I'm going to actually ask our final panelist, who is my lovely colleague, Alana Salsberg. Alana, I know you've given some thought to barriers. So what are the biggest barriers that we have to contend with when we create a part of a health system that's digital in this way? So I'm going to ask you to introduce yourself more formally and share with us your thoughts.
My name is Alana Salsberg, and I'm the Strategic Partnership and Stakeholder Engagement Lead at Frayme. I come to this conversation about mental health apps as from a number of different perspectives. I worked in digital, not specifically mental health, but eventually in digital mental health platforms for 20 years. I worked at, I'm now somebody who works in knowledge mobilization in the mental health sector. I'm someone with lived experience, and I'm also a caregiver to someone who lives with mental illness. And what strikes me in the survey feedback and in the chat itself is that a lot of what people are identifying as features and benefits that they'd like to see represented in the mental health system generally are features and benefits that they'd like to see in apps as well. So for example, low barrier access to services, better communication and integration between supports, cost efficiencies, data transparencies. These all point to a desire for holistic and multidimensional considerations of mental health beyond prevention and early intervention. And what I do worry about, having worked in digital, we have the digital sector likes to reinvent the wheel over and over and over again. And what we have seen on the ground with the consistent sort of fragmentation and oversaturation of certain services we're seeing in the digital space now. And as a caregiver to somebody who's living with severe mental illness, the light touch prevention and early intervention apps, it's almost dangerous to only have those types of apps available because a lot of people have their first encounter or experience with a mental health app or platform when they're in crisis. And if you go to a light touch early intervention or preventative experience without that warm handoff to further supports, it can be very dangerous for those people. So I think that we really need to look at a diversification. I've seen a lot of comments in the chat around peer support. And what that says to me is that people with lived experience are looking at other people with lived experience as really effective supports and experts. And that's not just at the prevention and early intervention stage, that's in all kinds of different contexts and experiences when it comes to mental health. And we have a bad habit of referring to mental health as this overarching, single dimensional experience. We don't talk about physical health that way. We need to start looking at mental health and talking about mental health in a multidimensional way in all of the various different contexts and experiences that go beyond low mood and anxiety. We need to be talking about bipolar. We need to be talking about schizophrenia. We need to be talking about people in active mental illness and severe mental illness and what sort of supports are needed for eating disorders. That diversification, I think, is a badly needed thing. The other thing that I would say in terms of barriers is that the lack of diversity, I think, could be looked at as being reflective of the same sort of marginalization and lack of diversity within the mental health care system itself. So the same sort of populations that are being sort of bracketed out are not being considered with the same sort of weight as depression and anxiety. And I'll throw it back to you, Shauna.
Thanks, Alana. And I have the pleasure of having these conversations with Alana every day. But I think, you speak really eloquently about this need for consideration of an entire continuum of care and that concept of stepped care and how do apps fit in that so that we are ensuring that those who have more moderate to severe needs are served within this system, within this continuum of care. And so that sort of advocacy for treatment, I think, is something that we hear again and again and again. And I'm seeing that in the chat as well, that folks want to know, how can apps provide treatment? And if they can't provide treatment, how do they connect to treatment that serves the types of needs, Alana, that you spoke to? Travis, I'm going to check in with you to see if there's any other pieces from the chat that we should maybe pull into this piece that Alana has shared before we go into more general discussion.
Yeah, absolutely. So there's been some talk about how sort of multi-feature apps and tools are expensive to build, but perhaps there's an opportunity for integration of sort of the single-use type apps using an algorithm that could help sort of integrate the different apps, or an app that helped to inform and bring together ways to evaluate the options, because a lot of people with lived and living experience don't actually know how to evaluate the different types of apps and compare them against each other. So there was a question specifically around, to what extent can we rely on AI and machine learning and software development to try to balance that that expertise, and how can we move forward with teaching or showing people how to evaluate different apps?
Great, thanks, Travis. And I think that's a big question. And so maybe Yuri, I'll ask you. I know you've done some work in this area, so I'll ask you to lead us on this piece, and we'll go from there.
Great. So thank you, Shauna. So I think the evaluation question is super critical. It's come up in many of the comments, both in terms of, if the app connects to other counselors, how do we know that those people have been trained? How do we know the app actually works? And so HRI did a study of apps and evaluation, and you can find this on our website. And despite the fact that there are thousands and thousands of apps, the number of apps that have been scientifically evaluated in rigorous formats is actually a very low number. It's in the hundreds, and those that have had randomized control trials or longer types of observation, you get to probably less than 100 those that have been really rigorously studied with long-term outcomes. And part of it's the evolution of where we are. But part of it, I think, is also people rushing to just do one evaluation and go on to the next thing. Some companies don't want to really do evaluation. And I think there's a difference between apps that are just for wellness and those that you actually want to use for therapeutic. And for those that you want to use for therapeutic intent, we really do need that more rigorous study. So we definitely need not only more studies, but we also need to be able to, the scientific community, communicate the limitations of those studies, and for providers to be able to know where to go to get reliable information. So with all the marketing that there is with apps and AI, it can be pretty overwhelming. Some of the marketing's pretty slick, but I think you have to do due diligence to find which ones have been evaluated. Most people don't have the time or the expertise to do that. So we need to think through how we're going to, as a society, generate that evidence and communicate it effectively to the public, both providers and patients and families. So that's an ongoing discussion by many groups. We'd love to hear from you what you expect for evidence, where you'd like to get that evidence. That's a really, really challenging thing. But I've been in the AI field for 3 decades. It's gone through several hype cycles where we promise the world, or some people promise the world, for manufacturing, for energy, and for healthcare. And while there are some progress in doing that, it's not a panacea. I was really struck by the comment you made, Shauna, earlier about, apps are not a healthcare system. And I think it's really striking because we already have a fragmented healthcare system. Apps are even more fragmented because they're not connected to a lot of things. But I'm worried also that there might be too much over-reliance on the government saying that we've funded some apps, and so we don't need to put more resource into mental health. Apps are definitely not a healthcare system. And I think apart from the research work, we need to figure out how to operationalize this. And this is sort of a big part of why we want to listen to you is, if we want to make these apps more rigorous, more effective with therapeutic intent, we need to design out that new healthcare system that's the hybrid. And we need to have patients and families at the forefront co-designing that. So I think we'd love to hear more from you as in the remaining time as to what would that digital ecosystem be like? What would a digital hybrid system look? What are your priorities? So let me pass it over to you, Sean, and to the other panelists to get their opinions, and the audience as well.
Thanks, Yuri, and thanks for holding me accountable to my bold statements. I appreciate that. Maybe I'll make another one, which is that I think what I'm hearing you say too is you're making a strong case for evaluation. And in many ways, our digital health world is not far beyond our physical health world, in which we sorely lack evaluation and outcome data. So I think a strong case to be made across that whole continuum of care. And I'm wondering, Gord, we're seeing some comments as well. One of the suggestions around apps should be considered evergreen, and that there should be an accountability to get updated. Gord, I know you want to weigh in on this piece, so maybe I'll pass it over to you and see what you'd like to add.
Thanks, Sean. And I want to touch also on Alana and Yuri's comments. As I mentioned before, people make me think. And so the idea that if I'm at the doorway that's not appropriate for me, there's a sign there that's very clear that says, here's where you go if you're in crisis. This is not a crisis place, right? Which is kind of counterintuitive for app sellers, because their idea is for you to come in the door, not to turn to another door. And so that counterintuitive concern for the person rather than for the success of the app, I think, is an important piece there. Sometimes these things are also like listening. I'm not very bright, but I listen to jazz sometimes, and I think I hear the notes they don't play. And so what's missing sometimes in our data collection is the people who don't have access, who don't even know there's apps, and all of that, and why is that? So that comes to mind. There was a comment in the chat box. I was really, I think she's been commenting regularly throughout the evening. I hope she's still with us. I think it's Christine. It is Christine. And she talked about the better help peers understand what their role is. So we have a bit of a thing going on this last 10 years where if you're a person with lived experience, we almost kind of worship you. Oh my, look, we got one. And they know everything. And I want you to know that a lot of us don't know too much. But we do know what happened to us, and we do know what helped us, but sometimes we don't know that may not help someone else. And so the idea that we have some training around respecting other people's pathways, that we have some boundaries about not being the answer, that we have some idea of when it's time not to be there, and what really is the value we bring to these conversations. These are skills. And these are learnings and knowledge, and this is somebody may have not had any of these skills prior to the mental health episode, prior to their struggles with substance use. It doesn't mean they can't acquire it afterwards. And some, of course, will have actually worked in the field and had these experiences, so they'll have pre-existing skills in these areas. So that idea that we're not all the same. There's a category, but it's not a label.
Thank you, Gord. And I'm just reflecting on our time, and there's so much in the chat that I don't think we've been able to get to everything, but we're trying to move through most of it. So Travis, I'm going to ask you, is there sort of one more really resonant theme or concept that you're seeing in the chat that maybe we haven't touched on yet?
Yeah, I think one of the big themes was around that piece around, what do we know about the efficacy of apps? How many studies have done? Are there standards that exist for implementing the apps? Can we do some crowdsourcing to sort of determine the app use and effectiveness? And how do we really support research to build the evidence base around which apps work and which features work within apps? And so that was a big thing, as well as the bridge from apps to real lifestyle change, right? So even if we do have the information about what apps work and which don't, and what's more effective, how do we bridge from app to actually real lifestyle change?
Awesome. Thank you for that reflection, Travis. And I'm actually seeing a final comment too here from Colin in Australia about the monetization of apps. And I think that ties really nicely, Travis, into what you're talking about in relation to ethics. So we're moving into sort of final remarks and closing remarks. In a moment, Yuri, I'm going to ask you for a few remarks, and then I have a couple kind of closing pieces that I've been thinking about. But before we do that, I just want to open it up to the panelists to see if there's any final thoughts or pieces that you'd like to share. Lena, go ahead.
Just very briefly, I love that thought, because to me, the thought particularly about crowdsourcing this, because to me, as Gord was saying, we're not the same. We are all bringing different, you can call it biases, but to me, they're all perspectives. They're all valuable perspectives and expertise to this. And the way that we are going to be moving this forward is together. And so that is figuring out how to evaluate these different apps and how to help folks choose among them in a way that is actually functional and functions both for folks at various levels of need and with different kinds of need, whether or not that's different kinds of 3 questions to ask yourself, and those will give you a ranking for which of these kinds of tools are going to be best suited to you. It could be something nifty like that. It could be something completely different. But I think there's so much innovation to be had there in terms of all of us coming together to really take that critical lens, and not necessarily to find the best tool, but to find the best tool for you at this time, and that's just something I'm really excited about to be doing with everyone on this call.
Thank you. And I think that that's a beautiful sentiment to kind of wrap up the discussion period around, really, we're doing this together and we're embarking on this together. So Yuri, I may ask you for a few final thoughts, and then we'll go from there.
Great. Thank you, Shauna. So a tremendous amount of information, both live and in the chat area as well. So I think some of the themes we asked people before and during this meeting what works, and there were lots of comments about how apps have useful education, how they've been used for assessment and for tracking your progress. Gord spoke very eloquently and passionately and to a very important topic about hope, and does this actually help you provide hope, and do you have a better self-empowerment and autonomy after using this, and to be able to have that control, getting to know yourself through the app. We talked a bit about also then what's missing, and we heard from Alana about how really some of these apps really cover some topics, but there are many other topics where there is no apps for that area, and so there are many gaps of areas where we do need to not only have an app for that, but think about how that app should work and how it should be designed. People asked about evaluation, and we mentioned briefly that some of the reports. There's a link in the chat area where you can go to the Homewood website to see our previous reports. Certainly evaluation needs to be done, and we need to figure out how to do that, how to disseminate it, and make it actionable for everyone. So I think that'll probably be an ongoing discussion that we'll have. People talked about privacy and ethics and how the data sharing. There's some comments in there. Homewood hosted a roundtable on privacy and ethics, so you can get the report there, and there are some great comments today as well about the need for that, especially in the digital age of high volume data sharing and AI and analytics, and who gets to see those decisions and analysis. And then finally, about barriers, we talked about connectivity and what does that mean, in connecting with other patients, connecting with providers, connecting with a healthcare system that's already fragmented. And so I think a lot of work needs to be done to talk about what it means to have a good connected app within a healthcare system. Cost was mentioned as a barrier, and being able to have confidence of who that is behind those apps, and having more clear disclosure and transparency of who's behind the app, so that a barrier isn't that you don't want to use it because you don't trust it. We want to have something that people know who's behind it and how it was developed. So a lot of ideas that I think are very useful for all of us who truly want to make the system better, and putting patients first and the public first. So thank you to the public who joined and provided all your great ideas. So let me pass it over to Shauna for closing remarks. Thank you.
Thank you, Yuri. And any great listening session involves continued conversation. And so the conversation doesn't end here. And we want to continue that conversation. There's going to be a link in the chat that will allow you to continue to fill out the survey. Look at that. Travis is already on it. Thank you, Travis. So please help us continue this conversation. And I think I have two thoughts. And if you've been in a meeting with me lately, or you've heard me speak lately, I apologize, because basically I'm a broken record about these two concepts, but they're really resonant, I think. And one is that just because something is good intentioned doesn't mean that it has intended impact. And so I guess a note of caution to all of us as we work in apps, that research is critical, and understanding more is critical. And I think seeing what's come up in the chat is indicative of how critical that is. We have so many questions, and Yuri, you said more questions than answers. So I think that's a collective responsibility to learn more before we do more. So please fill in the survey and help us learn more. And the other piece, maybe ending on a little bit more of an optimistic, hopeful, Gord, to your point, note, is this power of yet. It is not my concept, but the concept that we might not have achieved it, but we might not have achieved it yet. And so adding that word of yet to any time we're thinking about, we don't have an app that meets our need yet. We don't have apps that are integrated into the system yet. We can have these things, and I believe and have optimism that we will. So I will end on that positive note, and I'm going to hand it back over to Becky to sort of wrap us up. So thank you, everybody. It's been a pleasure.
Thank you so much, Shauna. Thank you, Yuri, Alana, Gord, and Lena for being here tonight, for joining us. To our attendees and guests tonight, we hope you come away from tonight's session with a sense that you've been part of something constructive, something meaningful. Contributions from people with lived and living expertise are vital to shaping impactful research. So we're really grateful that you've taken the time to share with us tonight. And this opportunity to collaborate with you, with folks from CAPSA, Frayme, CAMH, Harvard Medical School. This is the essence of what HRI is all about, bringing people together to make things better. So thank you again to everyone who filled out a survey. Just a reminder that survey is open till June 30th. If you'd still like to fill it out, it is anonymous. You can find the link on our social channels, on our website, and we posted it in the chat box here for you as well. If you'd like to get updates on this work by email, you can subscribe to our email list. We'll drop a link in the chat for you as well to sign up for that. And you can follow us on social to find out what's next at HRI. So our next HRI talk will be in September. We look forward to seeing you then. Thank you everyone for being a part of tonight's event, and we'll see you next time. Good night, everyone.